What if I told you that the same part of your brain that lights up during an orgasm also activates when you're in physical pain? Wild, right? There's a lot more going on with orgasms than just a moment of pleasure. I'm Dr. Camilla, host of the Intimacy Lab for Ubi Health. As one of the AI faces of Ubi's global network of over 1,200 medical providers, and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to issues around sex, sexual health, relationships, and intimacy. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. So today, let's dive into a topic that's surrounded by both fascination and confusion: the orgasm. What exactly is happening in your body and brain during an orgasm, and why do some people struggle to experience them at all? First, a little Anatomy 101. Did you know that the penis and the clitoris are actually homologous? That means they came from the same embryonic tissue, and both are packed with nerve endings, especially from the pudendal nerve, which plays a huge role in transmitting pleasure to your brain. But that's not the only nerve involved. For people with vulvas, stimulating different parts of the genitals, like the clitoris, vagina, and cervix, can activate different nerve groups, including the pelvic and the vagus nerves. When these areas are stimulated together, some people experience what researchers call a blended orgasm. So yes, your anatomy is capable of layering pleasure in pretty incredible ways. Let's talk about variability for a moment. Not all orgasms feel the same, and not all bodies respond to stimulation in the same amount of time. One of my patients once told me she thought something was wrong with her because she didn't orgasm from penetrative sex alone. But here's the truth. Nearly 80% of people with vulvas need clitoral stimulation to orgasm. That's completely normal, and it doesn't mean you're broken. It just means your body has its own unique wiring. And honoring that is part of understanding your pleasure. Now here's an actionable tip that really works. Kegel exercises. They target the pelvic floor, specifically the pubococcygeus muscles, or PC muscles, which support your pelvic organs and play a role in orgasmic contractions. Strengthening those muscles through simple exercises, like tightening and holding them for 5 seconds a few times a day, may increase orgasm intensity and even likelihood, especially as we age. Speaking of age, orgasms definitely don't have an expiration date. People report experiencing them well into their 80s and beyond. In fact, one study found that while the frequency of orgasms may change over time, the ability to feel pleasure doesn't go away. That said, it may take more time or different kinds of stimulation as hormones shift. And let's not forget the mind-body connection. Orgasms, like all sexual responses, are not just physical, they're deeply psychological. Anxiety, trauma, medications, even the temperature of the room can influence whether or not you orgasm. So if you're struggling, know that it's not just in your head, but your head does matter. Therapy, mindfulness practices, or just open communication with a partner can all help. One question I get asked often: can men have multiple orgasms? The answer? Yes, some can, with dedicated practice. It often involves learning to separate orgasm from ejaculation and taking advantage of the refractory period, or the time it takes for the body to reset. For some men, it's a few minutes. For others, longer. For women, it's usually shorter or even immediate, making multiple orgasms more common. And if you've ever worried that using condoms could interfere with orgasms, research shows it doesn't. The rate of orgasm for people using condoms is about the same as those who don't. What can matter more is comfort, communication, and feeling safe. Finally, I want to touch on something a lot of people feel ashamed to talk about: never having had an orgasm. You're not alone. Studies suggest up to 15–20% of women and a smaller percentage of men have never experienced one. If that's you, it's not a failure. It's an invitation to explore, to experiment, and maybe to heal. Sometimes, unlearning shame is the first step toward discovering pleasure. Worried about your own health? Start by checking in with the Ubi Symptom Checker at ubihealth.com. Its medical-grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And if you found this video helpful, like and follow for more doctor-approved info you can trust from Ubi Health.